This is Kimmerman from Kimmerman Studio. So why do we need lockdown nowadays? Because too much happening in the coronavirus case, and too much people are suffering now from different parts of the world. So the world needs a lockdown. In every countries, in every place, there should be a distancing. So why do we need that? Why do we need distancing and lockdown? So before I answer, before I share you the thoughts about this, I will share you about the brief summary of the coronavirus. So what is a coronavirus? Coronaviruses are a large family of viruses that are known to cause illness, ranging from the common colds to more severe diseases such as the Middle East Respiratory Syndrome and the severe acute respiratory syndrome. So what is a novel coronavirus, or what we know as nCoV-19 or COVID-19? So a novel coronavirus is a new strain of coronavirus that has not been previously identified in humans. So when was the first reported novel coronavirus 19 infection happen and where? So on December 31, 2019, a cluster of pneumonia of unknown etiology was reported in Wuhan, China, in Hubei province. So on 9th of January, Chinese authorities reported in the media that the cause of this viral infection or viral pneumonia was initially identified as a new type of coronavirus, which is different from any other coronaviruses discovered so far. This virus was temporarily named novel coronavirus 2019 or the nCoV 2019, which later they changed the name to COVID-19 and to SARS-CoV-2. So what are the symptoms of someone infected with novel coronavirus 19 or the COVID-19? These are the common symptoms: fever, cough, colds, sore throat, and some breathing difficulties. We also look for the following, such as rhinorrhea, limb joint or joint pains, headache, vomiting, and diarrhea. These, these things we usually check in the patient we are looking, because we are screening them every time they report as they are feeling feverish, coughing, colds, sneezing like that. So better we check them out so we can do the appropriate screening for these people. How is the novel coronavirus 2019 or nCoV-19 transmitted? Out of the initial cases reported in China, Wuhan City, most cases were at or were the handlers and frequent visitors of the Yuanan Seafood Wholesale Market, a large seafood and live animal market, suggesting animal-to-person spread. Some patients in the outbreak reportedly have not had exposure to animal markets, suggesting that some limited person-to-person spread is occurring. Some people are asking me if is there a vaccine for the novel coronavirus. As the virus is a newly discovered strain, vaccines does not exist yet. The best way to prevent the virus is to avoid being exposed to this. Is there a treatment for a novel coronavirus? My answer is there is no specific treatment for the disease caused by this. However, many of the symptoms can be treated and therefore treatment is based on uh, patient clinical condition. Moreover, supportive care for infected persons can be highly effective. People who think they may have been exposed to 2019 nCoV should contact your immediate healthcare provider. So, how can we protect ourselves from this pandemic situation? While the cause of pneumonia seems to be a novel coronavirus, transmission potential and modes of transmissions remain unclear. Therefore, it would be prudent to reduce the general risk of acute respiratory infections by number one, avoid close contact with people suffering from acute respiratory infections. Any symptoms such as cough, colds, sneezing. When you see such person, please avoid going near to him. Frequent hand washing. This is number two. Frequent hand washing, especially after direct contact with ill people or their environment. This is should be done frequently, especially the healthcare providers and those who are taking care of the sick. Number three, avoid close contact with live or dead farm or wild animals. Please, guys, if you see any animals roaming around, do not touch it. Huh? Do not touch it, please. Number four, travelers with symptoms of acute respiratory infection should practice cough etiquette. Maintain distance. That's why the distancing is important. 1 meter away from the person. Cover cough and sneezes with disposable tissue or clothing and wash hands. Number five, consider wearing a mask like this, what I'm wearing right now. Consider wearing a face mask when you are sick with cough or sneezing illness, with or without fever, and you expect to be around other people or in a mass gathering, but as much as possible avoid mass gathering. That's why we are doing lockdown. That's why they are doing distancing, and do not go outside, just stay at home. The face mask will help protect you from catching illnesses. I'll teach you about the cough etiquette. Cough etiquette number one, cover your mouth and nose with a tissue, then you cough or sneeze. Number two, cough or sneeze into your sleeve or elbow, not your hands, like this. When you cough, do like this, like this. Or if you have tissue, assuming that I have a tissue right here, cough like this. And three, place your used tissue in a rubbish bin. Rubbish bin or trash bin. And wash your hands. Number three, wash your hands with soap and water. Reason why we need lockdown and advised everyone to stay at home is to avoid further spreading of the coronavirus. Usually 14 days or 21 days is enough for someone with the virus to recover, and this time frame will reduce such spreading of the virus and creating more cases. So that is why we are advised to do lockdown. For a meantime, enjoy the time that you are inside your house. Stay where you are. Read books. Read more information about these COVID-19. Watch news. Stay with your family and your loved ones and just rest. Especially when you are sick, just rest. Drink too much fluids, water or juice. Eat the right kind of foods, fruits and vegetables. Do proper hygiene and pray to God that this pandemic will stop sooner. Okay, stay safe and healthy. This is Kimmerman Studio signing off.